Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
You may have noticed the Health Secretary, Jeremy Hunt, indicating on this programme that he wanted more money. And you may have noticed the Chancellor, Philip Hammond, in the autumn statement, conspicuously declining to offer it. So what is going on? Stephen Dorrell was a Tory Health Secretary and is chairman of the NHS Confederation, and he joins me now from Worcester. Mr Dorrell, were you surprised, were you disappointed not to hear more, or indeed anything, from Philip Hammond in the autumn statement about the NHS?
Well, I was very disappointed not to hear, in particular, actually, about social care. There's an easy slogan headline here saying what we should be focused on is NHS funding. It was actually Simon Stevens, the chief executive of NHS England, who said that if there was some spare money, it needed to go into social care in order to create a more efficient health and social care system, a more balanced health and social care system. So in an autumn statement where Philip Hammond was talking about the importance of productivity, I can think of no instance across public or private sector where a small investment by the government could have produced a bigger improvement in productivity through efficient use of the whole of the health and social care system. And a small investment in social care could have delivered significant improvements in the quality and efficiency of the whole health and social care system.
So, in clear terms, was it a mistake not to offer something? And what happens to the social care system if nothing is done?
Well, the answer is that it was a mistake, in my view, not to make an investment in social care. And the result of not making an investment of social care is, to put it in very simple terms, that needs that should be met by supporting people in their own homes or providing residential care end up in NHS hospitals. When we hear stories of full emergency admission wards, people not being discharged from hospital, full A&E departments, that is in part at least the result of failing to meet those demands through the social care system because it's inadequately funded.
I don't know if you were able to hear Paul Mason suggesting that this would be a crisis that would dominate news for the next 9 months or so through social care and the NHS itself. But I suppose the question is, given that money is tight, we're worried about the public finances, can the government actually afford to do much about this?
Well, all I'm doing is picking up Philip Hammond's own rationale for investing in a productivity fund. Actually, if you invest in social care, what you're doing is improving the productivity of the whole health and social care system and improving the quality of those just about managing people who otherwise find their family budgets under incredible strain and personal worry because of failures in social care.
All right, two things. Should Philip Hammond change tack and come back to the House of Commons and offer some more money, first of all? And second, as a former health secretary yourself in a Tory government, don't you think you're being disloyal by attacking him publicly?
Well, I think one of the key attributes of being involved in any form of public life, and now as chair of the NHS Confederation, is a willingness to speak truth unto power. And there is no good going into this winter saying it's all going to be all right, when we already have lengthening queues in A&E departments. We already have problems with hospitals unable to discharge people because of inadequate provision of social care. Now, the easy headline is to say spend more money on the NHS. That's not what we're saying. What we're saying is proper investment in the part of the system that isn't working will actually deliver better value as well as better care.
So should Philip Hammond come back to the House of Commons and do that?
Well, my answer is twofold to that. First of all, yes, he should. And secondly, he is also, in the autumn statement, this is one of the less noticed bits, said that we need to start thinking about the structure of public expenditure going into the next Parliament, because there'll be some commitments that need to be reviewed at that time. It's precisely for that reason that we from the Confederation, on a cross-party basis, with Alan Milburn, one of my Labour successors as Health Secretary, and also Norman Lamb, who was the Health Minister in the coalition from the Lib Dems, have argued that we need to look on a more long-term basis at these funding questions so we don't get into this kind of short-term impending crisis.
Stephen Dorrell, very interesting. Thanks so much for joining us this morning.
Now, before the last election, George Osborne promised the NHS in England a real terms funding boost of £8 billion a year by 2020, on the understanding that NHS bosses would also find £22 billion worth of efficiency savings. Since last autumn, NHS managers have been drawing up what they're calling sustainability and transformation plans to make these savings. But some of the proposals are already running into local opposition, while Labour say they amount to huge cuts to the NHS. Mark LaBelle reports.
Help is on the way for an elderly person in need in Hertfordshire. But East of England ambulance call operators aren't sending an ambulance. They're sending an early intervention vehicle with a council-employed occupational therapist on board. It's being piloted here for over 65s with non-life-threatening conditions. When they arrive, a paramedic judges if the patient can be treated immediately at home without a trip to hospital. Around 80% of patients have been treated this way, taking the strain off urgently needed hospital beds, though that's not always possible.
So the early intervention team has assessed the patient and they've decided that she needs to go to hospital.
The key to successful integration for Hertfordshire is being able to collaboratively look at how we use our resources, to have pooled budgets to allow us to understand where spend is and to let us make conscientious decisions about how best to use that money, to come up with ideas to problems that sit between our organisations, to not look at things in silos, but to look at things collaboratively.
This Hertfordshire hospital is also a good example of how collaboration can help. You won't find an A&E unit or overnight beds here anymore. The closest ones are 20 minutes down the road. What's left is nurse-led care in an NHS-built hospital. Despite a politically toxic change, this reconfiguration went through after broad public and political consultation with hospital clinicians and GPs on board. It's a notable achievement that's surely of interest to 60% of NHS trusts in England that reported a deficit at the end of September.
It's not just here that the NHS needs to save money and provide a better way of doing things. The government is going to pour in an extra £8 billion into the NHS in England, but it has demanded £22 billion worth of efficiencies across the country. In order to deliver that, the NHS has created 44 health and care partnerships, and each one will provide a sustainability and transformation plan, or STP, to integrate care, provide better services and save money.
So far, 33 of these 44 regional plans, drawn up by senior people in the health service and local government, have been published.
The NHS has been through 5 years of severely constrained spending growth, and there are another 4 to 5 years on the way, at least. That is a highly unusual situation. STPs themselves are an attempt to deal in a planned way with that drastic situation.
But with plans to close some accident and emergency units and reduce the number of hospital beds, there's likely to be a tough political battle ahead, with many MPs already up in arms about proposed changes in their area. This Tory backbencher is concerned about the local plans for his community hospital in Dorset.
I wouldn't call it an efficiency if you're proposing to close all of the beds which are currently provided for those coming out of the acute sector who are elderly and who are looking for intermediate care. That's not a cut, that's not an efficiency saving, that is a closure.
All 44 STPs should be published in a month's time, ready for public consultation.
Questions to the Prime Minister.
But even before that, they dominated this week's PMQs.
The government's sustainability and transformation plans for the National Health Service hide £22 billion of cuts.
The National Health Service is indeed looking for savings within the NHS, which will be reinvested in the NHS.
There will be no escape from angry MPs for the Health Secretary either.
Well, I have spoken to the Secretary of State just this week about the importance of community hospitals in general and Shaftesbury in particular. These are proposals out to consultation.
So what could happen if these plans do get blocked?
If STPs can't be made to work, the plan changes don't come to pass, then the NHS is going to see over time a sort of unplanned deterioration and services becoming unstable and service quality being affected.
So is the political will there? The NHS barely featured in this week's autumn statement, but the Prime Minister insisted beforehand that STPs are in the interests of local people. Her government's support will now be critical for NHS England to push through these controversial regional plans, which will soon face public scrutiny.
Thank you, Peter, for coming, and have a blessed day.
Mark Lebel reporting. Now, we did ask the Department of Health for an interview, but no minister was available. I'm joined, however, by the Shadow Health Secretary, Jonathan Ashworth. Welcome to the programme. Did you accept that the NHS is capable of making £22 billion of efficiency savings?
Well, we're very sceptical, as indeed are a number of independent organisations, about the ability of the NHS to find 22 billion of efficiencies without that affecting frontline care. When you drill down into the 22 billion, based on the information that we've been given, and there hasn't been much information, we can see that some of it is going to come from, for example, cutting the budgets which go to community pharmacies, which could lead, according to ministers, to 3,000 pharmacies closing, which we believe will increase demands on A&Es and GPs. And also that a lot of these changes which are being proposed, which was the focus of the package, we think are going to have to be, will effectively mean service cuts at a local level.
Well, do they? I mean, the Chief Executive of NHS England, who used to work for Labour, says these efficiency plans are, quote, incredibly important. The Independent King's Fund calls them, quote, the best hope to improve health and care services. It says there is no plan B. Well, do you have a plan B?
Well, on the sustainable and transformation plans, which is these plans which are being across England to link up physical health, mental health, social care, for those services to collaborate more closely together, to cooperate together, to move beyond the fragmented system we have at the moment, is important. But it seems to me that the ground has shifted. It's moved from beyond that into filling financial gaps. Because as we know, the NHS is going through the biggest financial squeeze in its history. Indeed, by 2018, head-for-head spending on the NHS will actually be falling. If you want to redesign services for the long term in a local area, then you need to put the money in. So yes, of course, getting away with having these services working better together, having a greater strategic oversight, which you would have had, by the way, if we hadn't have got rid of strategic health authorities in the last Parliament. But anyway.
But do you accept that this isn't an attempt to save 22 billion? This is an attempt to spend 22 billion more successfully, more efficiently?
Now, what the NHS is doing is that Simon Stevens said we need 8 billion, and in return, we think the NHS can find 22 billion
in savings. So you get 8 extra by 2020, but you have to spend 22 billion more efficiently.
But the problem we have now is that the government have not given that 8 billion to the NHS, which they said they would, because they've changed.
That's 8 billion by 2020.
Yeah, but what they've done is they've changed the definitions of NHS spending. So indeed, NHS England will get 8 billion in 2020, but at the same time they've cut things like the public health budgets by about 4 billion by 2020. So what you find in a local area is that the budgets that go into initiatives to tackle sexually transmitted diseases, initiatives to tackle smoking have been cut back. That the commissioning of things like school nurses and local health visitors, that has been cut back as well. And Simon Stevens himself said he can only deliver that 5-year project for the NHS if there's a radical upgrade in public health, which the government have failed on, and also if we deal with social care. And this week in the autumn statement, there wasn't an extra penny.
I understand that. But if you don't think the efficiency drive can free up 22 billion to add to the 8 the government's committed to take us to 30 billion by 2020, where would you get the money from?
Well, I mean, I've been in this post now for, 5 or 6 weeks, and I want to have a big consultation with everybody who works in the health sector, as well as patients, carers, families. I mean, I think you'd be surprised.
So you don't know?
Well, no, I think you'd be rather surprised if I had an arbitrary figure, 5 or 6 weeks into the job on that, which is why...
But your party's on an election footing. We were told at the Labour conference that they expected an election by spring of this year. You need to have some idea by now. You inherited a portfolio from Diane Abbott. So did she have no idea where the 22 billion would come from?
Well, look, you know, to govern is to make choices, and we would make different choices, wouldn't we? The Red Book in the budget last year scored billions of giveaways in things like inheritance tax, incorporation tax, and so on. We would make a different set of taxation choices. Our Shadow Chancellor believes that there's more that we can get in from things like tax avoidance and tax evasion. But what I do want to do...
None of that adds up to 22 billion, as you know.
What I do want to do is work on a plan and for the general election, whenever it comes, whether it is next year or in 2020 or indeed between next year and 2020, to have a costed plan for the NHS.
But your party is committed to balancing the books on current spending. That is currently John McDonnell, the Shadow Chancellor's position. What we're talking about, this extra 30 billion, 22 plus the 8, that is essentially current spending. That's what it is. So if it doesn't come from efficiency savings, where does the money come from?
Some of it is also capital. I mean, some of that is maintenance.
It's mainly current spending.
If you look at the details of the OBR, they've just switched about $1 billion from capital for the NHS into revenue.
It's mainly current spending. So how do you balance current spending and find another 30 billion for the NHS?
Well, that's why we need to have a debate across both the Labour Party, but with the public as well.
But every time we ask Labour what its policy is, all we're told is we need to have a debate. And yet you're telling the British people that we could have an election within the next 3 or 4 months. It's surely time for the debate to stop and for you to give us some idea of what you stand for. There's huge doubts about the government's policy on this. You're the official opposition. How would you do it?
Well, I will want to work with John McDonnell, our Shadow Chancellor, to find a package to give the NHS the money it needs. But of course, our Shadow Chancellor, like any Shadow Chancellor at this stage of the cycle, will want to see what the books look like or the latest financial statement ahead of an election before making commitments. But I am clear that the Labour Party has to go into the next general election with a clear policy to give the NHS the funding it needs, because we've, as I said, it's been going through the largest financial squeeze in its history.
But you say Labour will always give the NHS the money it needs.
Yeah.
That's not a policy. That's a blank cheque.
Well, it's not a blank cheque. It's an indication of our commitment to the NHS. I mean, look, under this Conservative government, the NHS has been getting about a 1% increase. Throughout its history, it's usually had about 4%. Indeed, under the last 5 years of the last Labour government, it was getting 4%. Before that, it was getting substantially more. We think the NHS should get more, but I've not got the access to the NHS books, if you like, in front of me.
You've got access to the general
which is
figures. The public's attitude is clear. The public thinks there needs to be more money spent on health. But they also think that should go cap in hand with the money being more efficiently spent.
Yes.
Which is what this efficiency drive is designed to release 22 billion. Do you have an efficiency drive if it's not the government's one?
Of course we agree with...
No, but you have one of your own.
No, we agree that the NHS should be more efficient. We want to see productivity increase in the NHS.
But do you know how to do that?
Well, one of the ways you can increase productivity in the NHS is through investment in equipment, in maintenance, but it's got a 5 billion maintenance backlog. Some of the high-risk maintenance backlogs in the NHS at the moment is something like 730 million. And this week again, we've heard that they are going to switch capital spend into revenue spend. So I have always believed, and I think the analysis and the research shows this, that when you invest in maintenance and capital in the NHS, that contributes to increasing its productivity.
But hold on. You're now talking about 5 billion for maintenance. The chief executive says it needs 30 billion more by 2020 as a minimum. So that's 35 billion. You want to spend more on social care, another 4 or 5 billion on that, so that we have proper care in the community. So by that calculation, well, I'm now up to about 40 billion, which is fine. Except where do you get the money and balance the current account at the same time?
Well, we're going to have to come up with a plan for that. And that is why I'll work with our Shadow Treasury team to come up with that plan when we head into a general election. But at the moment, what we are saying to the NHS is, sorry, you've not got the money, and we are not going to give you the investment, which is why we are seeing patient care deteriorating. Now, the staff who work in the NHS are absolutely brilliant, do incredible things, but every day we learn of the impact of the pressures. 180,000 waiting in A&E beyond 4 hours. Record levels of people delayed in beds in hospitals because there aren't the beds in the community to go to. So the NHS needs the investment.
We know that, and we know the government. We know the government's response to that, and many people think it's inadequate.
Yeah.
What I'm trying to get from you is what your response would be and what your reaction will be to these efficiency plans. Your colleague Heidi Alexander, she had your job, I think, earlier this year. There's been so many I've lost track. She warned the danger of knee-jerk blanket opposition to local efficiency plans. Do you agree with that?
Yes.
So every time a hospital is going to close as a result of this, and some will, and some wards, some other facilities, is Labour default position not just going to be we're against it?
Well, that's why we are going to judge each of these sustainability plans, as they're called, by a number of yardsticks. We want to look to see if they've got the support of local clinicians. We want to look to see if they've got the support of local authorities, because they now have a role in the delivery of healthcare in an area. We want to see if they make the right decisions for the long-term trends in population for a local area. And we want to see if they integrate health, social care and health.
And if they don't, and therefore you will not bank that as an efficiency saving, you will say, no, that's not the way to go. That's going to cause more problems than it cures. You are left then with finding the alternative funds to keep the NHS going.
Well, the problem is, if you are cutting beds, for example, we're cutting beds, or the proposal is to cut something like 500 beds in Derbyshire, and if there isn't the space within the community sector in Derbyshire, then that is going to cause bigger problems for the NHS in the long term. So it's a false economy. So an example like that, then we would be very sceptical that the plans could work.
Would it not be honest, given the sums of money involved and given your doubts about the efficiency plan, and they're shared by many people, I understand that, to just say, look, if among the wealthy nations, we spend a lower proportion of our GDP on health than most of the other countries, European countries included. We need to put up tax if we want a proper NHS. Wouldn't that be honest?
Well, I'm not the Shadow Chancellor. I don't make taxation policy, and I think John McDonnell...
You can advise him.
You're tempting me down a particular road, Andrew, as I can tell by your wry smile. Look, John McDonnell will come up with our taxation policies, but look, when we were in government, had an ambition to meet the European average. The way these things are measured have slightly changed since then, but we did have that ambition, and we indeed, for a few years, we met it. I think everyone accepts we need substantial investment in the NHS. Everyone accepts it was extraordinary that there wasn't an extra penny piece for the NHS or social care in the autumn statement this week, and as we run into a general election, whenever it is, we will have a plan for the NHS.
John Ashworth, thank you very much. Come back and speak to us when you've worked out what it is you're going to do. Thank you.